To start with our case updates, we have 42 new cases who have tested positive today for a total of 659 in British Columbia right now. By health authority, that is 339 in Vancouver Coastal Health, 218 in Fraser Health, 47 on Vancouver Island, 46 in Interior Health Authority, and 9 in the Northern Health Authority. We have one additional long-term care home in the Vancouver Coastal Health region where one healthcare worker has been detected with COVID-19, and that is the Broadway Pentecostal Lodge in Vancouver. In terms of the long-term care homes, we have no additional cases today at the Lynn Valley Care Centre, though unfortunately we do have one additional death from that outbreak. Hollyburn and Deltaview, the German-Canadian House, Dufferin Care Centre, Little Mountain Long-Term Care, and Evergreen Heights, which we've reported on, have had no change in the number of residents or staff affected at this point. But there has been an increase at Harrow Park, where we now have 28 residents and 27 staff who have been affected by COVID-19. Currently, there are 64 people hospitalized in British Columbia, and of those, 26 are in intensive care unit today. On the positive side, we now have 183 people who have fully recovered from COVID-19 in BC. We have been, as you know, we've talked about this many times, actively monitoring our supplies of personal protective equipment, recognizing that the protection of our healthcare workers and our healthcare systems is of paramount importance in this outbreak. In the past week, we have seen a dramatic increase in use as we've had more people with COVID-19 in hospital, and we understand the absolute need to keep people safe. But the burn rate, as we call it, is much higher than we would have expected, and we are putting in place measures now to try and control that and be more efficient and effective in how we're using PPE. We have new shipments on order. We're looking at things like alternative supplies across the board, alternative ways of preserving personal protective equipment, so it is available both now and in the future. And we're at a bit of a critical phase with personal protective equipment. This happened quite quickly. We have had a number of supplies on order for some time. Some have arrived, thankfully, and we are actively looking at how we can get as much as we can in the short term. But we are looking at alternative supplies and ways of managing to be more efficient in PPE, and more of that will come out over the next coming days.